Prescription drugs are expensive. Medicare prescription drug plans, the actual drug costs are high. We just did a show a couple of weeks ago on the Medicare drug cap of 2000, but it's still something I want to talk about because, majority, or I'd say at least more than half of my clientele are on Medicare. And so the other half is getting closer and they're worried about the cost of drugs, prescription drugs in particular. And so it's something I want to get a little deeper into today. And the other reason is because my co-host, speaking of people that don't really understand all of it, there he is, Tony.
Right.
Tony, you said you wanted to talk about it because you sent me this article, which I'm going to share my screen for those that are watching. The title of the article is Prices for Top Medicare Part D Drugs Have Nearly Doubled Since Entering the Market. This was an AARP study, I guess, or analysis.
Yep.
And that surprised you or not?
No, I wasn't surprised, but I think it's a problem, which is why I thought maybe we should talk about it. And I know you always have interesting takes, as you so kindly pointed out at the beginning of the show, that are sometimes alternate to my takes when it comes to healthcare.
You, Tony, and I joke, but a lot of people don't understand how this works. And I started with Medicare years and years ago and worked into financial planning. So it's a big part of it. And I always understood it and I take it for granted. But I want to get a little deeper in it because there's some changes. And this was from the Public Policy Institute, AARP, January 2025. So they're saying that prices have doubled. And if we look at this chart, you could see the lifetime price change versus inflation. And they're using CPIU. So we go right at the top here, Trulicity, which came out in 2014, 100% price change since it's come out, and 33% is the inflation rate since it's come out. So, there's a ton of drugs here. This one's a big one here, Janumet. I think that's a leukemia drug, 293% increase versus the 53% increase in inflation since it started. So, I'm not going to disagree with you. What they're saying is that the longer the drug has been on the market, the prices are going up even higher as a percentage. So I don't know. I think a lot of people look at this and be like, well, the big bad drug companies are charging a lot for drugs and someone's got to do something about it. And AARP is an advocate for people that are 50 years and older.
Yeah.
And so they're saying, hey, we got to solve this. We have to figure this out. So I'm not disagreeing with that at all. There's the link if you want to read that in detail for those that are watching. So what's the answer here, Tony? What do we do about the drug costs? Do we see a lot of what happens is a lot of people vilify the drug companies because they're the ones setting the pricing, but they're the ones bringing these drugs to the market. So, and it's not cheap to bring them to the market. You got a lot of
they have a lot of high expenses. Agreed. They have a lot of high expenses. But why are these same drugs, Dan, less expensive in every other country, or pretty much every other country?
Yeah, I know. And again, it's like, well, who's paying for it? Well, let's get the Americans to pay for it, right? So what is the government going to do about it? They're going to come to the rescue. Yeah. Right. You should be excited about this. Medicare Drug Price Negotiation Program. I want to share my screen again. For those that are watching, they can see the link below. Turns out our government, the U.S., is working to negotiate pricing on the major drugs. So the Medicare Drug Price Negotiation has already begun. And they have 10 so far drugs that they have identified and negotiated pricing. So here's the list. Januvia is the first one listed. Turns out there are 843,000 people on that drug since this was in 2023. And the list price for that drug is $527, but the US government through Medicare has lowered that cost to $113. Not a bad negotiation. 80% discount. And that's for diabetes. Now, if we look, let's pick the one that the most people are on this list. Eliquis, Bristol Myers Squibb, prevention and treatment of blood clots. You see that, Tony? 3.9 million people are on there, are using that. Almost 4 million people. Average cost per month, $521. And the negotiated price through Medicare is $231. So they reduced the price by 56%. And that's a big one. That's, 18. What is that? Look at that. Total prescription drug cost in 2023, 18 trillion. Is that 18 billion dollars on Eliquis in this country. How's that? Wow. Look at some of these drug costs. Look at this one, Tony. I got to get my glasses. Imbruvica. The retail price is $15,000 a month. So, what do you think of that? He's on mute. Tony's on mute. He doesn't even know
it's
it. This
tough.
has been a great show.
Yeah, it's tough. And really quick, back to your let's not vilify the drug companies, or people vilify the drug companies. It is costly for them, but all you have to do is look up if they're publicly traded companies. Most of them are the big ones, obviously. All you have to do is they have to record their profits. Look up their net profits for 2023. And then talk to me about their net profits, and sometimes surplus. They even have a surplus in the billions. So I'm not going to feel sorry for the drug companies, first of all. I think they're jacking up the prices. It's been proven. I mean, that one guy got taken to court because the EpiPens, he bought out the company for the EpiPens, and hopefully he's in prison now because
you can't. Okay, so if you say you can't make a profit, or you limit,
I'm not saying you can't make a profit.
You gotta. I know, right? So what? But who's fair? The government's going to come in and tell us. But look what's happened, right? So
the government will mess it up. I admit. I mean, the government has helped here with the Medicare,
good, right?
But only with they are only doing 10 drugs out of the hundreds people.
They got 15 more on the list for next year.
That's good.
And so I don't know how they're picking which ones.
Yeah, but, levodopa is the drug for Parkinson's that both my mom and dad are on, and I'm hoping that will eventually be on one of these lists. I don't think it's on the first 10, but
these, but look at this though. Some of these prices are huge.
Yeah,
and let's take Jardiance, right? That's for
that's a big one.
Chronic kidney and heart failure, diabetes. They negotiated from $573 a month. And I say they, the government. To $197, but still, that's $197 per month for somebody.
Yeah,
right.
Or for the insurance companies. I mean, the insurance companies sometimes get stuck covering this too.
Well, let's talk about that. So we just did a show. That's talked about it. I'll put it up there for anyone that missed it. Don't forget about this spending cap. $2,000 is the cap now for Medicare beneficiaries on drug plans. That's the most they'll pay out of pocket for all their drugs. So if you're on one of those drugs that we just mentioned, and it got negotiated down to $200 a month, if it's covered by your drug plan, that one drug alone will bump you at the max.
Mm-hmm.
Right? $200 a month, you'll be by October, you'll have already hit your max. So what about one of these other drugs that cost $10,000 a month? Well, if it's covered by your drug plan, you're capped out at $2,000. So this is great for you, right?
But is the drug company still getting the full $10,000, or
I'll show you? That's the question. So where's the money coming from?
Yeah, if my deductible's $2,000, who's paying the thousands and thousands of dollars
per month
to the drug company? Are they still getting the full amount? Do they get a lesser amount, or are the insurance companies taking the hit?
Before we jump into that, which I'm going to get to right next, I want to point out that here's a tip for those on drug plans with Medicare. You have a $2,000 max. If you are taking drugs, a list of drugs, make sure that every drug you're taking is first included by your company, and second, that you go through them. A lot of people will go, I'll use a lot of here in Florida, people will say, I can't get this drug, it's too expensive with my company. The out of pocket is $700 a month for it. I'm going Canadian drugs and getting it from overseas, like you mentioned, is cheaper. Well, why?
Sure.
Let's not get into that, but they'll go through Canadian Drugs Pharmacy, or they'll use like GoodRx or some other pharmacy discount plan and not go through their Medicare plan, and to save money. But by doing that, they are not adding to their max out of pocket. So if I buy my drugs elsewhere through Canadian Drugs something, and it costs me $500, that doesn't count toward my 2,000 max out of pocket. You have to go through Medicare and your drug plan to get that. So there's a tip for you. If you have a lot of drugs, or even if you can save money in the short term, it may make sense to pay the full price early to hit your 2,000 max out of pocket. But the question is, Tony, who pays for that above 2,000? All right, I'm on a drug. It costs me $10,000 a month. I pay $2,000 in January. I get it free for the rest of the
You're
year.
done.
Really? Yeah, you do. That's the new rules, 2025. Who's paying for that? Who? Jeff Bezos? Elon Musk? Are they paying for it?
No.
Here's how it works. Once your 2,000 cap is reached, it's called catastrophic coverage phase. Okay. The plans are required to pay 60% of the drug cost. The plans, this is going to be your WellCare, your United Healthcare, your Humana, your Aetna, whoever you buy your health Medicare Part D plan from, prescription drug from, they're going to eat that 60% of the drug cost.
Your Medicare Advantage plans.
Right. Or a lot of people have standalone drug plans with their supplement. Yeah. Those companies that they're paying a premium to have that drug plan with, they're going to cover the 60% of the cost. Medicare is covering the other 40. Oh, good. So I don't pay anything. Medicare will cover it. Well, who's Medicare? I'll get to that in a minute.
You are.
Drug manufacturers.
Dan Wendell.
The other rule that came with the Inflation Reduction Act, drug manufacturers must give a discount of 20% on brand name drugs. So that discount gets passed on to the plan and to Medicare.
Sure.
So the manufacturers are getting beat up a little here with this negotiation.
Good.
The drug plan, the insurance companies are getting beat up because they have to cover 60% of the cost. Good. And Medicare has to pay the other 40. So Medicare, meaning the general public, is still on the hook. So I'm putting the link down below for anyone that wants to get where I'm getting all this data from. But let's get into it here, Tony. This is going to get exciting now. So we now know, all right, I got a $2,000 limit. I'm going to just load up on drug. So 1 year, I went on a high deductible plan. I did a show on it.
Well, nobody's purposely loading up on drugs.
No,
because they're cheap.
But here's what happens.
Or covered.
Right? So one of my kids broke his fractured his arm. It was horrible. We were at a swim meet. He was playing in the playground and he fell. And the cost to go through that, we hit our max out of pocket early in the year. So my entire family hit their max out of pocket. So the rest of the year, all of my medical needs were covered 100% by the insurance company. And it wasn't a cheap plan. I still paying my premium. But at that point, it's like, oh, you're not feeling well, let's go to the hospital, right? Like, because it's all covered. That mentality can easily happen. So the same can go here. If you're on 10 drugs and you've hit your max out of pocket of 2,000, you're just going to fill those drugs. It's a real boon to you because you're going to buy those drugs anyway normally. But now what the government has done is it eliminates a lot of people from like cutting pills or foregoing groceries so that they can get their drugs, or just not taking the drugs at all.
Not taking the drugs at all, which is a problem. I mean, people have died because they couldn't afford EpiPens. That's a fact. So in the past,
right? This solves that. But who's paying for it, right? So for 2025, Medicare Medicare's actuaries have estimated that Part D plans, the drug plans, will receive a direct subsidy of averaging $1,417 per enrollee. What does that mean in English? That means for everyone that joins a plan the US government through Medicare is gonna pay that plan $1,400
Yep.
just to have them on the plan. So, hey, that's why you see the ads. Come join, especially during open enrollment. Come join this plan, join that plan. Because if you do, they're going to get a subsidy from the government. And
Yeah.
then they hope that you don't use it, right? Because
Right.
now the new rules are that they're going to have to chip in now for these drugs. Moving forward, the largest portion of Part D spending in this country will be accounted for by direct subsidy payments to the plan. So those subsidy payments total 54% of the budget of Medicare's budget.
Sure.
So 54%,
Which is covered two ways: by money we pay in every paycheck from your earned income. The government takes out money for Medicare from everybody who works and has earned income. So everybody's pitching in, and from your Medicare premiums that you pay once you're on the plan.
that's it. Here's
Yep.
the exact number breakdown for you, Tony. You said it right. Funding for Part D comes from general revenues. Ooh, that sounds nebulous.
Yeah, you never.
General
That's always
revenues.
the
What is general revenues?
woohoo.
US tax dollars, right? 75% comes from general revenues. 15% comes from beneficiary premiums, so people paying into
Yep.
Medicare. And then 13% from state contributions. Now, the astute people looking here will say, what's a state contribution?
Uh-huh.
That's
I don't know.
taxes, right? That's
Yeah.
state taxes, or the states chip in.
I didn't
right?
know about that states
Well, because
pitch in.
there's low income subsidies and there's Medicaid that's
Yeah.
administered at the
Oh,
state
the
level.
Medicaid is run by the states. Yeah.
So, but if you look at that, that's two government taxes and then
Yeah.
15%. But if you count the math, you're like 75 and 13 and 15, that's more than 100%. What's going on here? So I don't know. Kaiser, I got that from the Kaiser Family Foundation, but generally speaking, these are probably estimates. You're looking at maybe there's double counting on the state contribution versus the general revenues, because the federal government sends money to the states. Bottom line is most of it is coming, 90, 85, 90% of it is coming from tax dollars. Everyone's tax dollars. Which is why when you say the government's going bankrupt, but Medicare is untouchable, it's like, well, that's because it's funding drug plans. Originally, Part D enrollees were supposed to cover 25.5% of the cost of a drug plan, but now, as we see, they're only covering 15%. So people that are paying into it are actually covering less of the cost. The federal government's picking up the tab. And, however, Tony, it's not fair. I know everyone wants to pay their fair share. Fair is everyone gets the same. In my house, I got 3 kids. If I get a pizza and there's 5 of us and I cut it, and make 5 big slices, do it. They're all equal, right? That's the fair share. That's what I say. But I'm a bigger guy, so I'm like, I should get a bigger piece, right? I'm the one buying it. But anyway, higher income Part D enrollees. So if you're of a higher income and you're on a Part D plan, you pay a larger share of the Part D costs. So you're paying between 35 to 85, depending on your income, 85% of the cost. Some people are paying fractional amount of the cost.
Sure.
So it's kind of a progressive tax system. By the way, anyone watching wants to get all this data, kff.org. There's the link. Kaiser Family Foundation. They do some good stuff. They have a lot of data on it, and you can read all about how this works. But my point overall, Tony, we did the show on the 2000. It's great. It's great, right? There's a cap. People won't have to, not eat so they can pay for their drugs. And the government's trying to help.
Right.
But, whenever the government tries to help, where that goes. And they've done some things. They're setting limits as to what the drug companies can charge and what these insurance companies can charge for their plans. And a lot of people, especially those on a lot of drugs, especially expensive drugs, are going to see their drug costs go down. And there's going to be people that the drug cost hasn't been negotiated, and they're like, why won't mine get negotiated? Like your parents, or they might say, well, this drug's not even on the formulary, so I don't even get that $2,000 cap. I want this drug to be on the Medicare formulary. Well, this is what's going to happen. So, but the bottom line is it's helping a lot of people, but the money's coming from somewhere, Tony.
Yeah. Oh,
it's coming from somewhere.
It always has to come from somewhere.
So
But I still don't think, in my opinion, we can discount the greed factor. And any time public companies publicly traded, they're not about helping people. They're all about pleasing their stock. They work for the stockholders, in my opinion. So when you talk about Pfizer, let's not go too easy on them, because even with that $2,000 deductible and people having $10,000 a month drugs, ironically or surprisingly, you can just look up what Pfizer profited last year. And
well,
then
they're
you
getting
won't
paid.
feel, and so if they're still able to make billions in net profits per year, then let's make the deductible $1,000, because they're still doing fine, right,
Right.
Dan?
But at some point, though, Tony, the money's still got to come from somewhere.
Right.
So either you force these drug companies to reduce the cost, which is what
We've done a
they're
little
trying to
bit.
do.
Sounds like they've done a little
But
bit, which is
but
good.
and I'm not defending these companies in any way. I'm not in the industry. I don't know enough about it. But
Right.
my guess is when you force pricing, when you create like a minimum wage, when you do things that the government's setting standards, that will hamper the business. Because if I'm a drug company and I'm saying I'm going to hire the best scientists to create the latest and greatest cancer drug, but it's going to cost me a lot of money. If the government's saying, yeah, you could develop this cancer drug, but you won't ever reap a profit from it, because the amount of money it's going to cost you to make it and the limits we set on what you could charge people for it, it'll take you 50 years before you even break even. And so the drug company's going to say, well, what's in it for me? And the scientists that are doing it are going to say, well, I'll go work somewhere else and do something else. Now, I get the altruistic nature, and you're altruist, you're more of a caring person than the average Joe, I'd say, just from my experience with you. And I get that. But you have to balance the profitability of these drugs to be developed. It's cutting edge stuff, right?
Yeah. There's pros and cons on both sides of the story. Yeah. And you do have to look at that. So,
and socialized medicine is where this was heading, right? It's a form of eventually, well, why are we even paying anything? Let the government pay for it. That mentality is like, well, of course, I'm not, if I'm not paying, let the go. But at the same time, you are paying because taxes, right?
Well, and especially in America, I mean, we are the government. We the people. It's basically, right. I mean, so we're paying one way or the other. It's just,
but not everyone is, Tony. Not everyone is.
Distribution. Yeah, it's who's paying. It's the distribution of the wealth.
Progressive tax system.
Yeah,
and
it's
so
progressive.
So I want to point out that all of these changes are great, but just remember, and when people are talking about, remember, the government is the one spending it, which is your tax dollars. Social Security is a little different because your money is going into the program, right? So people, they like, well, I'm paying taxes into Social Security, I want it out. Well, okay, so if that's the case, I'm paying into the Medicare Part D drug system. I'm not on Medicare. I don't even take any drugs. Why are my tax dollars being used for that? The same case could be made. Why are my tax dollars being used to fund this war? Why are my tax dollars being used to build that highway? I don't even have a car. Like, so there's a balance here, is all I'm saying. But for my clients and for my people that are on Medicare, the key is knowing how this drug system works, finding the right drugs that are going to be in your formulary, making sure that if you're getting to a point where you're spending a lot, get that cap, get that 2,000. You can also spread that out monthly, use the system, but just realize that the money's not growing on trees. And eventually this is going to blow up on us if we don't come up with a better solution, which I don't know the answer to, but that's not what this show's about.
Nobody's had the answer either. I mean, healthcare is a big, big problem that nobody's been able to solve. So
exactly.
Yeah. I think some of the things they've done, like negotiating drug prices, I think that's good.
Yeah, I mean, that just makes business sense. If the Medicare is going to be the ones paying 40% of the bill on this drug for 1 million people, they better be able to negotiate a darn good price from that drug manufacturer.
Yeah.
Otherwise, they're just not doing, that's government waste. It's like, well, here, we'll pay you whatever your price is. No, I love it. Negotiate, all for it. But
The
once they start letting
$5,000 toilet seat. Remember
right,
that?
right. I don't want that. I don't want that. So, but with so many
Government just
people,
paying whatever they say. Government's paying. It costs this much.
right, right,
Okay.
right. So
Yeah.
that's exactly right. But the thing is, when people aren't on Medicare and they're paying much more for that same drug, people are starting to look and saying, "Wow, okay, Medicare is pretty good." But it's not because they're just great negotiators. It's because tax dollars are funding it, right? It's
Right. Yeah.
it's just like the Affordable Care. We did a show on the Affordable Care Act, and the cost of insurance is really high for some people, but for most, it's not. And why is that? Because they're either getting subsidized by their government or
Right.
by their employer. Without
Sure.
subsidies, the prices are out of control. And I think
Yeah.
this is showing that
Yeah.
the curtains being open and people are like,
It
oh
is.
man,
Yeah, that graph on that AARP
right.
article from the institute that, handles that, that's amazing.
20,000 a month for a drug? Come on, get out of here.
Yeah.
Well, if you don't have it,
And
you're
the
gonna die.
price increase over 10 years,
Right. Right.
100%.
Right. After it's been issued. So it's like, oh, okay. So it's
People are
working. And now
thinking
you're raising
inflation
prices.
is I love how the internet is crazy with people, talking about the inflation on eggs.
Mm,
When it's like,
yeah.
oh, it
Check
went from 23 cents an egg all the way to, 40 cents. Well, we're talking about 20 to 40 cents. But a drug that costs thousands of
right.
dollars went up 100%,
Right.
when you're talking about thousands and thousands of dollars. I mean, that's inflation. Healthcare inflation is crazy through the
Healthcare
roof.
inflation is crazy high, and
Yeah.
the government's trying to help, but my thought is anytime the government tries to help, you better watch out. Someone's paying for it, and it's most likely me and you. So,
Well, no,
uh,
let more you than me, hopefully, and that's where I can feel good about it.
yeah, right. Well, maybe the lesson is let's just get on these expensive drugs so we can get our money's worth.
No, you don't want that.
No, you don't. You
People
don't.
don't
And maybe
people
that's
don't people don't purposely take drugs because they're free. I mean, I wanna
the
point
answer.
that out.
Maybe that's the answer, Tony, is as a country, we change our health system so that we're not dependent upon these drugs, which could be potentially solved through lifestyle changes. Now, certain drugs are
Wait,
the cutting edge.
now you're cutting into my you wait, I have to change my diet. If I have to stop eating burgers and pizza and start eating kale, that's where I draw the line. That's where I
Medicare
draw
for all. All right, Tony, thanks for a good show. We'll catch everyone next week.
All right.
All matters discussed in today's show are for informational purposes only.
This show is not investment advice.
Dan Riddle nor Dolphin Financial Group are affiliated or endorsed by any government agency.
Investment advisory services are offered through Dolphin Wealth Management, Inc., a registered investment advisor in the state of Florida.
Insurance products and services are offered through Dolphin Insurance, Inc.
Dolphin Wealth Management, Inc. and Dolphin Insurance, Inc. are affiliated companies doing businesses as Dolphin Financial Group.
You should talk to someone at Dolphin Financial Group before implementing any of these strategies or ideas.